So if you have symptom of cervical arthritis or spondylitis, it will also help you to get rid of it and then come out of it. So precautions, doctor will ask you to avoid crocodile pose in very adverse conditions. Otherwise, 90% cases you can perform the crocodile pose because it gives a very light stress to your body. Okay, if you have a very serious issue of back injury, if you have a hernia, or if you have some other serious problems that depends on body to body, then if doctor says that you need a complete bed rest or you can't lie down on your belly, and lying down on a prone position is totally prohibited, then in that case you will have to avoid crocodile pose. Otherwise you can perform crocodile pose. Okay, now I'll show you, once you are done with the crocodile pose, how you have to relax. Okay, that is called relaxing crocodile pose. So how you can perform it, just let me show you. Once you are done with crocodile pose, what you have to do, you have to relax on crocodile pose also. Okay, just to make sure that everything is okay. So what you can do, once you are on crocodile pose like this, then what you have to do, you have to stretch your both hands out, lift your head off the floor, and place one palm of yours on the upper arm of other hand. Okay, so place your left palm on your right upper arm and right palm on left upper arm, and wherever these two your forearms cross, place your chin there and relax there. And you can also increase gap between your feet. You want to stretch your toes out like this, you can. If you want to turn your toes out like this, you can. The main thing is you have to relax there. Okay. And after one round, again lift your head off the floor, open your hands out, and then interchange. Now place your right palm first on the left upper arm and then cross the other forearm, and then again place your chin on one of the forearms and stay there and relax there. This is called relaxing crocodile pose. So how this is going to benefit you? It will help your body to come back to the parasympathetic nervous system zone. What is parasympathetic nervous system zone? Where your heartbeat comes to normal, where your blood circulation comes to normal, where your breathing comes to normal, and your body comes to passive mode, and your body cools down properly. So this posture you can use for cooling down. You can also call it Shithilavastha. Okay, like this. Stay here. So this is relaxing crocodile pose. I don't think that anybody in any case should avoid this posture, because rare to the rarest cases you will have to avoid this asana. Otherwise you can perform this asana in any case. Yes, there is only one case, if you are on the third trimester of the pregnancy. So that those pregnant women who are on the third, and in some cases even doctor prohibits performing any yoga posture lying down on the belly, even in the second trimester. So the pregnant women can perform this asana on the first trimester without any worry, but from second and third trimester, that depends on doctor's advice. If doctor allows, then you can also perform it in that cases also. In some adverse cases of hernia, doctor ask you not to lie down on the belly, otherwise you can do that. Yes, but yes, in some cases if you had cesarean uh, delivery and the stitches are still the marks of the stitches are still fresh, then you have to avoid it. And if you have gone through some operation and stitches, the marks of the stitches are still fresh, then avoid it. Otherwise it is one of the safest posture, one of the easiest posture to perform, so you can perform it. Okay, now let's move to the next asana. So the next asana that we are going to perform is called plank pose. This is one of the most famous asanas around the world, and this is called Phalakasana also. So let's go for it. The plank pose, that is also called Phalakasana. Again, it is performed in down facing position. So to perform the plank pose is the best way to start it from cat pose. So in cat pose, what you can do, you can keep your hands in a straight line with your shoulders, and the same gap you can keep between your knees, and then slowly stretch your right leg out and then stretch your left leg out and keep your whole body straight. This is called plank pose. If you feel that performing plank pose is tough for you, then what you can do, you have to decide and you have to find out which body part is creating problem in performing plank pose. Are your hands creating problem, or your back creating problem, or your legs are creating problem? So like if you feel your hands are creating problem in holding the plank, so what you can do, you can shift your body weight towards your feet like this. You can stretch your ankles in dorsiflexion. See, so if this is the normal plank, then you can flex, you can stretch your heel back like this, and then you can shift your body weight towards your toes. So this is the way you can make it easier to hold the plank. And when on the regular practice, when you will be able to hold this plank for longer, then you can slowly try to shift your weight towards your hands and go to the perfect plank. Okay, and if you feel that the lower part of your body is not supporting in holding the plank, it happens with especially with some people who have unwanted fat accumulated around their pelvic floor, or unwanted fat on their thighs or calf muscles, or below lower back. So in that case, what you have to do, you can increase the gap between your feet like this. If you feel that no, still it is tough, then you can increase the gap. The maximum the gap, the easier it will be for you to hold the plank. Okay, and once you will be able to hold the plank on this position, then slowly you can focus on decreasing the gap between your feet, and a day will come when the gap will be minimal and you will be holding the perfect plank. Okay, and if you feel that yes, your back is creating problem in holding the plank, so in that case what you can do, when you're holding the plank, so relax your spine like this and then come back to the plank. The moment your back starts paining, release the pressure, stay there for some time, and then come back. So this way you can put pressure on your lower back and then release it. Put and release it. And then slowly try to increase the time of holding your back with the pressure on it. Okay. So this is the way you have to hold your plank. This is called Phalakasana also. And you should, and make sure that you are not looking up or down. Just look towards the floor as per the comfort of yours. Okay, make sure that your cervical is relaxed. Here I want to bring your attention towards one myth. People say that if you hold plank, it'll burn your belly fat. It'll make your it will tone your abdomen. But let me tell you that yes, it'll tone your abdomen, but that is not the first thing it'll hit. If you hold the plank, the first thing it will target, that will be your bones and your joints. Let me tell you how. When you start learning how to hold plank, the first thing it targets is your skeleton, your bones, and your joints. Because unless your wrist, your elbows, your shoulders, your spinal cord, your knees, your ankles are strong enough to hold your body on air for a long time, how can it benefit to the muscles? Muscle will come in second place. The first place, the first priority will this asana will given as a benefit is to your bones and your joints. See, cause your skeleton holds your body weight. So here, when you hold the plank, the first benefit it gives to your joints, and once you increase the holding time, like if you start holding plank for 30 seconds, it will benefit your joints. If you make the target of 1 minute, it will start making your bones stronger, increasing your bone density. And when you will be able to hold the plank longer, at least for 3 minutes, 5 minutes, 7 minutes, then the time will come when it will hit your muscles. So the people who think that just by holding a plank they can tone their belly, this is your misconception. Okay, why? Because if you want to reduce your belly fat by performing plank, then for that you will have to hold plank for a long time, where you will have to follow the theory of Hatha Yoga. Hatha Yoga means holding a posture at least for 3 to 7 minutes. So how plank works, when as a beginner you hold the plank, if you are holding plank for 10 seconds, 15 seconds, it will hit your joints. It will make your joints stronger. How many joints we have in our body? Around 250 to 360, that depends on individual to individual. Okay, and once you increase the holding time of the plank from 30 seconds to 1 minute or 2 minutes, then it will give benefit to your bones. It will increase the density of your bones will become stronger. And this way, when you are holding plank on a regular basis for 2 minutes, 3 minutes, it will make your skeleton stronger. We have 206 bones in our body. A child born with 260 bones, and later on 54 bones merge into one another to form adult skeleton. So that adult skeleton will get benefited first. So when you're holding plank for a few seconds, your joints will get toned. When you will increase the time, then your bone density will increase. And when you will be able to hold plank for a longer time, at least for 3 minutes or 7 minutes or 10 minutes, then what you will have to do, then you will have to keep your body in observation, that if you're holding the plank for 3 minutes, 4 minutes, 5 minutes, 6 minutes, 7 minutes, is it really creating a contraction around abdominal muscles? And then slowly you will feel that contraction around your abdominal muscles. That is the time when your belly will start getting toned. And this way you will have to check, if 7 minutes, then 7, then set the target for 10 minutes, then 20 minutes, 30 minutes. You can increase the holding time as much as you can. The longer the holding time, the deeper the benefit of plank will go in your body. First, if you are as a beginner holding the plank, it will benefit your joints will become stronger, then your bone density will be improved, and then when you will become pro in holding plank. And when you will start holding plank for longer, like for 7 minutes, 10 minutes, then it will target your muscles, and your it will tone your belly. Okay, so this is the way it works. So people think that by holding plank for 30 seconds and 1 minute they can reduce their belly fat. No, it won't happen. You hold plank for 1 minute for years, it won't work. You will have to put hard yoga theory, you will have to give pain to your body